Hello everyone. As we are getting close to the exam, I think some of you might be having anxiety, fear and FOMO. Now let's keep all these things aside and try to focus inwardly. Accept the fact that there is only 8 days left and you can also use it wisely. You're going to do three things. Number one is going to revise the all highlighted points in your own notebooks, and secondly you're going to revise with images because the revision will be more quicker, and number third you will keep on trying to solve MCQs. This is Dr. Auroraj, and now let's try to quickly revise all the past 5-year topics. I have a huge faith in all of you that you're going to pass. Therefore, try to be positive and keep marching towards your success. Let's go. Now, the most common site of fracture of clavicle is going to be at the lateral 1/3 and medial 2/3. Remember, your clavicle starts from here and it goes towards the sternum. So this is going to be the medial part, this is going to be the middle part, and this is going to be the lateral. So the most common fracture is going to be at the lateral 1/3 and at the medial 2/3. So remember, this is going to be very important. Ankylosing spondylitis. The moment you have seen this X-ray, you're going to mark it as what? Bamboo spine. I'm pretty sure each and every one of you have identified this as bamboo spine. Now, for clinical questions, you're going to also remember a few more points, that the patient is going to be presented with ESR and CRP elevation, and he is going to have autoimmune HLA-B27, and of course as the X-ray deposits he is going to have bamboo spine, and we are going to do Scober's test, and the treatment is going to be NSAIDs. We are going to give indomethacin. Let's look at the X-ray here. The patient is having a scaphoid fracture. Yes, scaphoid is the most commonly fractured bone. This is going to be scaphoid, and most commonly dislocated is going to be a lunate. There is a mnemonic called as "She looks too pretty, try to catch her." She looks too pretty, try to catch her. Yes, and this is going to be glass holding position, also called as scaphoid cast. And the patient is going to have what? Is going to have dorsiflexion and radial deviation. Now let's talk about the giant cell tumor, and this is going to be our radius, and here you can see a giant cell tumor. It is going to be at the metaphysis, and it is also having what? Soap bubble appearance. In aneurysmal bone cyst or tumor, there are going to be blood filled lesions in the bone, especially at the epiphysis. Yes. Now let's look at the splints. First splint is going to be what? Knuckle splint. It has letter U, knuckle splint, and it is commonly used for ulnar nerve injury. This is going to be knuckle splint. Now let's look at the cock up splint. Remember, it is showing upwards. This is commonly used for what? Radial nerve injury. Very good. And the third one is going to be Denny Brown splint. This is commonly used for congenital talipes equinus varus. Great. Let's look at the claw hand. Partial claw hand. Look at the image, and this is due to what? Ulnar nerve injury. Complete claw hand is due to both the ulnar and median nerve injury. So look at the images carefully. Great. Now let's look at the median nerve injury. These are the following tests done. They are going to be: number 1, Fallon test; number 2, reverse Fallon test; 3 is going to be pen test; and 4 is going to be pointing index test. Most of these median nerve injury tests starts with the letter P. Let's revise. This is going to be what? Fallon test. This is going to be a reverse Fallon test, and this is going to be what? Pen test, and at last we have the pointing index test. Ulnar nerve injury tests are going to be card test, book test, or the Igawa test. These are the ulnar nerve injury test. Ulnar nerve injury test. Good. Next. Now let's try to quickly identify the following images. This is going to be what? Winging of scapula, and that is due to long thoracic nerve. And the second image is going to be talar brace splint, and I'm pretty sure each one of you probably could have identified this as Milwaukee splint, very important. And the fourth image is going to be Pavlik harness splint, very important to remember for the main exam. Next, these are the other important images. First image is going to be what? The enchondroma. They are most common tumor of the ant. And secondly, we have here an extra growth that is called as what? Osteochondroma. And the third image we can see classically sun ray appearance, that is due to what? Osteosarcoma. And here we see the Pott's puffy tumor, that is due to frontal sinusitis. Next, these are the two important fractures have to be remembered for the main exam. Number one is going to be what? Monteggia fracture. Remember, this is going to have anterior dislocation of the radial head, and there is going to be a fracture at the proximal part of the ulna. Whereas Galeazzi fracture, remember, this is going to have posterior dislocation of the ulnar and fracture at the distal part of the 1/3 of radius. There is a mnemonic for this. I'm pretty sure every one of you might have heard this. That is called as Murga. Monteggia is for ulnar nerve injury and Galeazzi is for radial nerve injury. Now let's try to look into these 5 images. Look at the image number 1. This is the fracture of which bone? This is the fracture of ulna. Exactly. It is called as what? Nightstick fracture. It is called as nightstick fracture. Great. And the second image, this is called as what? You can see the radial styloid process fracture at the distal part. This is called as Schaufer's fracture. Chauffeurs in French means driver. So when the driver is driving the car, when he's holding the steering, and if he meets with the accident, this part of the bone is going to be fractured. It is called as what? Chauffeur's fracture. And number 3rd is going to be Brodie's abscess. This is going to be Brodie's abscess. Next, we have other 2 important instruments. The first instrument, look at this. This is having a sharp edge. This is called as bone cutter. Bone cutter. And the last image is going to be bone nibbler. Great. So these were a few important images that has to be quickly revised. I'm pretty sure that you guys are doing an amazing job. Keep the faith in you that you're going to pass this time, and the universe is going to have a great blessing to you all very soon. So stay positive, try to do your best, and definitely you're going to crack this time. Wish you guys all the best. See you then in the upcoming next videos.